Now I'm going to show you how you would wrap your own arm. So first thing you would do is make sure your arm is clean, and you'd put some moisturizer on your arm. And then you're going to take a cotton stockinette and cut it so it fits and reaches to the armpit and just past the wrist or the hand a little bit. Okay. Now we're going to start with the finger wrap first, and this is the mollelast that I like to use. And we're going to do a loop and a half at the hand. Kind of keep your tail kind of short, keep everything close so you can kind of hold on to it. So after you do a loop around the wrist, you're going to do, start with a finger. Doesn't matter which finger you do. You're going to lay it over the back of a finger and go in close. Start at the cuticle and then overlapping generously, you're going to go till you get to the base of that finger. Okay? If I came from this direction, I'm going to leave the opposite direction around the hand. And now I did a half a loop around the hand. I'm going to go to the next finger. So now I'm doing the index. And you're going to start your first loop where you see the swelling. If they don't have swelling way down on this end, you can just start at the mid-knuckle if you'd like to. You go. And again, here's your V at the end of each finger. And now I'm half a loop around the hand again. I'm going to the next finger. Let's pretend that they didn't have swelling on the end of their finger, just from the mid-knuckle down. We'll do that. And I'm pinning it right there so you can see the V at the end of that finger. Now my palm is wide open. There's nothing going across my palm. I'm going to do the next finger. And it looks like I'm close to running out. If you run out on the finger, you need to take it back a finger, because you want your tail always to end up on the hand. So right here it ends up on the hand. If I didn't need to wrap my pinky, I can go ahead and start with a hand wrap. Say I needed to wrap my pinky, I'm going to have to start a whole new mollelast. I can do it a little higher so I don't have the exact compression in the exact same spot. I'll do one or two lightly around there, a wrist, and then I'm going to go toward my pinky. Start at the distal end. I'm keeping it close. I'm not having it way stretched out here because it's too hard to handle. So keeping it close, going in a little closer each time till I get to the base of that finger. And now I've got all this left over, so I'm going to just loosely get rid of it. In my hand, if I feel like I needed extra padding there, or just up the arm. Just loosely. This is a finger wrap, not an arm wrap, so compression is only in the fingers with this. So don't pull hard. Okay. Almost done. All right, and now I'm going to tuck it. But it's perfectly okay to only wrap the fingers that are swollen. It might be just 2 or 3 fingers. All right. Now we're going to do the 6-centimeter short stretch bandage. The brands that I use are Rosedale K or Comperlon. You're going to start with this with the roll on top and the tail coming out from the bottom. You're going to start it above the wrist, kind of mid-form. I like to use a table to kind of help hold on to it and tuck it in there. Okay, and now I'm going to start going, overlapping about half the width of the bandage toward the hand. So I'm going distal with this one. This is a hand wrap. It starts at the midforearm, it ends in the midforearm. Once I get past the wrist, I'm going to spread my hand wide. If I don't spread my hand wide, my patient is going to have pain along the pinky side of her hand. So spreading it wide until I get to the base of that thumb. Once I get to the base of the thumb, I'm going to alternate on either side of the thumb, above and below the thumb, 6 times, and then go back up the arm. Keeping my hand wide, staying out of the pinky, kind of coming in close to the base of that thumb, alternating on either side of that thumb. I think that was 4, 5, and 6. You can always kind of lift up here and count. Do I have three layers right there? And then I will go up the arm, overlapping about half the width of the bandage, putting a little tension on it as I go. You want your tape already ripped and ready to secure. Okay, so that's what the hand wrap would look like, okay? If you had issues around the thumb, you could put foam around there, even a donut circle around the thumb if you needed to. I had one patient that with the bandages on, it felt like her hand curled up like this. So we actually put a firm foam here to kind of keep her hand flat. I think we might have done it in the palm side too to keep her hand flat. You can look at the fingers. The fingers tend to get slightly darker or purplish. You can check for capillary refill by pinching at the end. When you release, within a second, the color should come back. And so I am not cutting off circulation, even though sometimes it kind of feels like it. Okay? If it bothers a patient, they can kind of pick up on it and stretch it a little bit, and I'm going to encourage them to move their arm as much as they can. All right, now we're going to wrap the arm, and we're going to use 2 layers. Layering is very important with using low stretch bandages, so you can get the compression without pulling hard. The layering helps to provide that. So both of these are going to start at the wrist, and my goal is to end at the armpit. The first layer that crosses the antecubital fossa is going to do an X up here. And what that's going to look like is as I'm going to do a loop here, closer, closer. Once I get right below the bend of the elbow, I'm going to do a high sweep up, a full loop and a half up in the upper arm, and then a low sweep down. So it looks like an X right here at the bend of the elbow. And then after that, I'm just going to go back up like where I left off. Okay, and that protects the arm from being irritated at the bend. Now here's the artiflex. I'm going to loop around the bend of the elbow, at least 2 layers on the front of the bend. All right, and let's go ahead and start this. Now if a patient has a hard time getting it started, they can kind of put a piece of tape on there. Aim your tail up a little bit, and then go straight across like that. I like to use a table. I like to try to keep my arm straight as I'm doing it as well. Keep my elbow straight. So I'm going up. I'm keeping the tension on there. Once I'm right below the bend, I'm going to start my X, which is a high sweep up. Kind of use my armpit to secure it. And then a loop and a half right up here. And then a low sweep down. All right, I see some wrinkles, so I'm going to try to smooth them out a little bit. And now this was my last circle. And now I'm going to go ahead and go up the same distance between loops or circles. I can secure it there. If there's trouble, you can even use a pillow. If you put a pillow there, keep your elbow straight again. It's a little easier. Oh, let me get up a little higher. Over the front of the bend, you can do it a little looser at the front of the bend and then snug it up on the back. And so you use your chin to secure it until you get your tape on, okay? And then between each layer, you want the patient to move to make sure it's not like, ooh, it's hurting right here, because then you only have to take off that part of that bandage. So it feels pretty good to me. So now I'm going to start the next one. And this is just going to circle all the way up. I want my tail pointed up a little bit so there's no tail poking out by my wrist. Keeping a little tension on it. It's not gapping like that while I'm doing it, and I'm not yanking on it either. So I'm just keeping steady tension on it. The spacing is going to depend on how big the arm that you're wrapping is, or how long it is as well. So your goal is for it to end at the top, at the armpit. It's okay to have 1.5 loops. Past that, you can always go down on those, and that helps secure it up top so it doesn't try to slide down. It's not okay to have 2 or 3 loops extra, because then you're going to put too much pressure on the top of the arm, and it's going to keep the fluid from escaping out of the arm, and you want that fluid out. So I'm trying to keep my spacing level. I'm almost at the top of the arm here. Okay, and I've got just 1 loop, so that's fine. I'm going to grab my tape. Hard to find. And secure it. And I would put extra tape on there as well. Usually the last layer I put 2 or 3 pieces of tape to secure it. I can do a loop all the way around if I need to. All right, now once my patient is wrapped, they're going to say, ooh, it feels tight. I said, yep, it's supposed to. That's how the swelling comes out. So I'm going to have them do some exercises. So I have them touch the back of their head 10 times. So I do that. And I want to make sure it's not digging in anywhere in particular. It's not going to feel comfortable to hold that flexed position. So they don't want to hold it, but they want to move it. Next thing I'm going to have them do is touch their thumb to each finger, have them open and close their hand. I'm going to have them do circles with their wrist, have them rotate their forearm, supination, pronation, and bend in that elbow. And my goal is for them to be moving their arm with these bandages on and wearing these bandages 24/7 until I see them again. If they can practice rewrapping, it's best to rewrap daily.